Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go through a few tests that you can do at home to determine if you are at risk for injury. There's not a specific injury that you would be at risk for, but these can show you some very obvious dysfunctions in your body or things that you need to work on. And if you do test positive or you fail these tests, you really want to look into correcting them, because it will allow you to, it can allow you to be injured further down the road. These are just gross tests that test basically the whole lower extremity. So you want to make sure that if you find a positive finding, that you consult someone to determine why that positive finding was and what is the cause for concern. The first test we're going to do is a squat. For this, you're just going to start, spread your feet shoulder width apart, stand up nice and straight. You want to try and squat to the ground. You want to be standing in front of a mirror when you do this, or have a partner. What you're looking for is your back to stay straight, your knees not to come together, your knees to stay equidistant apart, your heels to stay flat on the floor, and your butt to be almost able to reach the ground. If you can't meet all of those criteria, there is some dysfunction going on. The next exercise or the next test that you can do to predict if there's a possible injury is single leg balance. So all you're going to do is, it's as easy as it sounds, you're going to stand on one leg, eyes open. You want to be able to hold that for about 30 seconds. Try it on the other leg. Eyes open. 30-second hold. Then you want to close your eyes. Again, you should be able to hold it for 30 seconds. Wobbling is okay. Touching down with the other foot is not. So again, it's not necessarily specific on what dysfunction is going on, but it is a heads up that there could be a bigger problem that could cause future injury. And the final test is the figure 4 test. All you want to do is sit down and cross one ankle over your knee. Ideally, this knee should lay completely flat. If it pops up or you're unable to have it by itself fall flat, that's indicative of a dysfunction. But more importantly, what you want to do is compare sides. So bring the other leg up. Now, if you see a difference in the height of the knee, like you see here, this knee's higher than the other knee, there's some dysfunction going on. Again, we have to look a little bit further as to what is occurring and why that's happening and what injury we could possibly be setting ourselves up for. But that is a quick test to determine if you are, in fact, at risk for some type of injury down the road. If you test positive for any of these or fail any of these tests, please call us at 215-997-9898.